High oxygen diving typically refers to the activity of using high concentration, oxygen-enriched gas mixtures during underwater dives. In the diving community, various terms may be encountered, such as enriched air, safe gases, denitrogenated air, EAN, enriched air nitrox, high oxygen 1, high oxygen 2, and more. These are essentially different names for high oxygen, a nitrogen-oxygen gas mixture similar to air. The conventional diving gas mixture is air, which consists of approximately 21% oxygen, 78% nitrogen, and 1% trace gases. In the context of recreational diving, high oxygen refers to nitrogen-oxygen mixtures with oxygen content exceeding 21% and falling below 40%. It is commonly abbreviated as EX, where EN32 indicates a mixture with 32% oxygen and 68% nitrogen. Increasing oxygen content while reducing nitrogen can lower the risk of decompression sickness. High oxygen diving allows divers to extend their stay in deep waters and reduces surface intervals after diving. However, high oxygen diving comes with potential risks, including oxygen toxicity, central nervous system toxicity, and other health issues. Therefore, engaging in high oxygen diving requires specialized training and strict adherence to safety procedures. Due to the lower nitrogen content in high oxygen compared to air, some divers may use high oxygen not to extend dive time or surface intervals, but to minimize nitrogen absorption during dives. This approach is known as leveraging the physiological advantages of high oxygen, and it helps decrease the risk of decompression sickness. In recreational diving, gas mixtures with oxygen content exceeding 40% are not commonly used. This is primarily due to the need for special oxygen compatibility for all diving equipment in contact with higher oxygen ratios. Oxygen content exceeding 40% is typically reserved for technical dives involving decompression procedures. Diving organizations mandate conspicuous labeling on cylinders containing gas mixtures other than compressed air. Standard high oxygen cylinders are colored yellow, with a green marking band on the shoulder and white or yellow letters indicating EON or nitrox. Cylinders of other colors usually have a 15 cm wide sticker on the shoulder with a 2.5 cm wide yellow border at the top and bottom and a 10 cm wide green marking band in the middle. The inner part of the green band may have the label nitrox or a similar designation in yellow or green letters. All high oxygen cylinders should have a label indicating oxygen content, mix date, and maximum diving depth. Cylinders lacking a high oxygen label must undergo testing before use. While high oxygen provides physiological advantages within no decompression limits for air diving, the increased risk of central nervous system oxygen toxicity necessitates professional training. High oxygen diving should not be attempted without obtaining a certification, and individuals should refrain from using high oxygen until qualified to do so. Follow me and learn more about photography and diving knowledge and skills.